Hi, I'm Dr. Rachael Degurse, owner of Pearl Skin Body Rejuvenation, and today we're going to talk about neuromodulators, aka Botox Dysport Xeomin, and their uses for treatments other than wrinkle relaxation. The first area that we are going to talk about today is TMJ. So TMJ is basically arthritis of the jawbone, and one of the things that can cause that is clenching or really tightness of the muscle here called the masseter. The masseter is our main muscle that causes jaw movement, so you use it for chewing, talking, all of those important mouth functions. But you can use neuromodulators in there to relax that muscle so that you don't clench as much, particularly during times when you are unaware of it, like sleep. When you do that, it really helps to relieve the pain related to TMJ. The most important thing about neuromodulators for this area is that you want to make sure to not get an injection in a place outside of that muscle, because you could get a salivary gland, which is not going to be useful at all. It's not going to be harmful in the long term, but it just doesn't treat the problem that we want to treat. It also takes quite a bit of neuromodulator in that area to relax the muscle, because it tends to be a pretty strong muscle when you have TMJ pain. We're also going to talk about platysmal bands. So platysmal bands are when you see this grimace face, doing it a little bit, and you get these really prominent cords of muscle that stick out on the front of the neck typically. And what can happen is that muscle gets really tight and then it starts to pull down on the lower jaw. So it creates a jowling look and kind of heaviness in the lower face. So usually when we inject this area, we're also injecting along the jawline as well as any of those platysmal bands that you can see when you do this grimace face. The main risk associated with this area is that you can overtreat that area. And when that happens, you can get some neck weakness, and it makes it feel like you have to work really hard to keep your neck up. So you just want to make sure that when you're getting this area treated, it doesn't get overtreated. All right, the next area that we are going to talk about is trapezius injections, aka Barbie Botox. You might have heard that term before. Basically, what we do is we inject the trapezius, which is the muscle that is in between the neck and the shoulder area. It actually extends down the back as well, but this is the area that we're treating when we do that. And people might do this if you feel like you get a lot of tightness in your shoulders from stress, or maybe the shoulders are looking really prominent in that area and you want to give the illusion of an elongated neck or like a more slender shoulder if you're wearing like a dress that might expose your shoulders more, for example. So that is an area where we might put some neuromodulators in. This technique was developed for treatment of migraines. That's a common place that we inject for migraines, but you can use it for aesthetic purposes as well. It's a pretty low risk area, except if you inject outside of the trapezius on accident. So if you go forward too much, there is a bundle of nerves and blood vessels in the front of your neck here that you definitely want to make sure that you're not injecting. And then if you overtreat that area, it can give you some muscle weakness in your neck and then also with shoulder movement. So you just have to be a little bit cautious about the dose and making sure you're injecting into the body of the trapezius. So finding an experienced injector in that area is important. All right, and then the last place that we're going to talk about is doing Botox or neuromodulators for migraine treatment. Now, Botox does have a specific indication for migraine treatment. You can look into getting that covered by your insurance through, typically a neurologist is going to do that. There's actually a totally different product that they release for treatment of medical conditions. So you might want to look into that if you have that insurance benefit. But if you do not have that insurance benefit, I get a lot of questions about migraine treatment with neuromodulators, and The full treatment is actually 31 injection sites, so it's quite a lot of neuromodulator if you want to do the full treatment. Now, a lot of times people will get relief if you only treat the upper face. The reason for that is a lot of people who suffer from migraines get a tension headache component related to their migraines. So basically, you get a headache related to muscle tightness, and then that triggers your migraine. So if you treat the muscle tightness with a neuromodulator, then you can help prevent migraines. And the most common place that people will get that is kind of in this upper face area. So if you treat just the upper face, forehead, and in between the eyes, and a lot of times you can get some pretty good relief from your migraines without having to do the full 31 injection sites. Another area which you might want to consider if that's not enough is this trapezius area, because a lot of times people will carry tightness in their shoulders and neck that contributes to that tension type headache that triggers migraines. So you just want to be careful in the areas outside of the upper face, making sure you have somebody who's experienced injecting those areas, that they're not going to cause any neck weakness or shoulder weakness. But the upper face area is a very safe place to treat if you wanted to start with that area for treatment of your migraines. So if any of these areas are interesting to you, or you'd like to explore them for treatment with neuromodulators, you can reach us at 719-249-4210 or book online at our website, pearlskinbody.com. We are located in Colorado Springs, but if you are in other area of the country, then I'm sure there's a lot of places around you that can offer these treatments.